Unofficially, today is recognized as Blue Monday. And there's been lots of talk around this concept of Blue Monday. And I'm wondering, and I was doing some reading as well about that there's controversy around it. And I'm wondering, Warren, if you could talk to us a little bit about what is Blue Monday, and is it anything really that is official, or should we really be calling it Blue Monday? Or
Sir, I wouldn't put it in the category of official.
Right.
But one of the things that, having looked at it from a financial perspective, I had read some information today regarding this is when most people's credit card statements come in. So this is the arrival date of the reality of what many people have to unfortunately accept regarding the holidays, and that perhaps they overspend. And this is the end of sort of the fairy tale for a lot of people, which I'm sure makes your phone ring, and makes my phone ring as well, of people that just really all of a sudden are becoming very aware that the holidays are over, and perhaps their debt is hopefully not insurmountable, but for some people it is. And there's some heavy realizations that come in. New Year's has passed, and most people's vacations are over, and there's this, and seasonal. That we were not done winter by any means, and all of this compiles for many people and can really feel insurmountable.
Do you both, and Desiree, hopefully you can speak to this too, do you find that there is a bit of a spike in terms of this time of year, or is it centered around holidays and obviously the financial as well? But in both of your works, do you see that there is more of a blip on the screen in terms of people coming and seeking out support at this time of the year?
Go ahead.
When we look at when our biggest blips are, or our biggest service or crisis calls are, it's actually more so April and November-ish, when the seasons start to change. But we definitely do see a blip of the fact that there are people, like you said, who are coming into the fact that, this is the end of, it's the holiday kind of hangover, but also the days are short, and sunlight does play a big role into mental health in a lot of different cases. But it's also, the New Year's resolutions, you're not meeting those resolutions. How are you going to be able to pick up the pieces? Where should you have gone? Where did you go wrong? So it's a lot of that. But
Graham, why do you think that there's not as much discussion about youth?
It's hard for me to say, because I'm induced into the world of youth mental health. It's hard for me to compare if there's one of more than the other. But what I will say is that there's sort of a give and take. My line of thinking is very much that a lot of youth mental health, not all, but a significant portion, comes from the adults in their lives. And I think that when there is a lot of emphasis put on adult mental health, there's a great benefit within the home. So I think on one side of the story, that's actually a very positive thing, that it's not just an adult or just a kid's issue, that both are talked about. But to emphasize the adult is great in the home. It helps the child to see, to benefit from a role model who is talking about their mental health, who is receiving services for it. Of course, there would be a negative side. If we don't talk about the youth, what are they to do? But one thing I've really noticed, especially in the last just few years, even our local school board has had, 1 in 5 days, and there's a lot of education happening in the high schools. But the great thing about it is that youth themselves are really pushing for that discussion.
The mental health discussion within the school system probably is a relatively new discussion. There is a provincial body that has been tasked with helping school boards across Ontario build their mental health response for youth. It's called Mental Health Assist. And there was some tenuous days with the government switchover as to whether or not the current government would continue to support that. But just yesterday, we received word that yes, indeed, they still are seeing mental health for youth as some work that they want to keep their focus on. And so within the school system, generally during the day, kids are in school. And so for them to access services, we're in a rural area, transportation is a big issue. For them to access service after school hours or to drive to a walk-in clinic or something like that can be challenging for families. And so the idea is that there's a number of partnerships with agencies such as CMHA, Family Connections, and other agencies who come into the school and provide services. The high schools have a mental health and addiction nurse that comes to the high schools 1 or 2 days a week. And so there is a lot of effort put on. Earlier somebody talked about silos. There's a lot of effort put towards collaborating together on these services so that the youth, if they're not accessing a school counselor, then they can access a community counselor, and those resources are built into the school system itself.